in the green grass is the law of nature, but the law of nature is never a formula. Miracles do break it. Let's have a look at our miracle. Presenting snake in brown grass. 8-year-old male presented with recurrent episodes of pain, redness and diminution of vision in the left eye. On examination, the visual acuity was 1/60 in the left eye. There was conjunctival congestion with flurried anterior chamber reaction. Lens was cataractous and posterior segment details were not visible. He was diagnosed as a case of iridocyclitis and treated with systemic and topical steroid. On 1 week follow-up, the anterior chamber reaction subsided and the vision was 6/60. And that's what we saw in the slit lamp. A greyish-white live coiled patch in the anterior chamber containing the highly motile body of a small worm stuck to the iris. Lens had anterior subcapsular cataract. Patient didn't give any history of fever or travel to endemic area. Immediately he was sent for a complete blood count, ESR, eosinophil count, peripheral blood smear and the chest X-ray, and in fact all were within the normal limits. The patient was taken to the operating room. A paracentesis wound was made at around 11 o'clock position. We can see the moving worm in the anterior chamber at 8 o'clock position, white in color, highly motile and curled at both the ends. Viscoelastic was injected into the anterior chamber and the worm was taken out. And there it's out. The fantastic moving end of the worm, as if fish without water. After removal of the worm, we can see that there is a fibrin sac adhered to the iris, which might be the site for lodgement of the worm. The worm was 12 to 13 mm long and its highest width was 0.25 mm. It was rounded at both the ends. On microscopic view, it had thick cuticle with longitudinal ridges and circular annulations. The movement of the worm is very well appreciated in the video. The cuticle is shedding with time. The peristalsis movement is also appreciated. Based on the morphological characters, the worm was identified as adult male Dirofilaria immatus. Dirophilariasis is a helminthic zoonosis endemic in southern and eastern Europe, Central and Minor Asia and Sri Lanka. Definitive host is dog, but sometimes they may be cats, foxes, coyotes, ferrets, sea lions and wolves. Human infection is rare. Most common vectors are infected mosquitoes, especially of genera Aedes, Culex, Anopheles and Mansonia. Worm has affinity for subcutaneous tissue, so it usually involves the periorbital, orbital, subconjunctival or subtenons tissue. From there it migrates from the bloodstream to the anterior chamber. In our patient, there was no evidence of involvement of subcutaneous tissue surrounding the eye. The route of intraocular penetration is still unknown. In human beings, the worm failed to reach adulthood, so human is the dead end and transmission from human is also not possible. So what is the uniqueness of our case? Dirofilaria in human, rare. In India, rarer. In eye, rarest. In anterior chamber, rarest of the rarest. Only 2 previous reports from India exist documenting dirophilaria in the anterior chamber. But dirophilariasis with cataract as a complication of recurrent iridocyclitis is the first case to be documented ever. So to conclude, we can say that worm infestation, even though uncommon, should still be a differential diagnosis in recurrent iridocyclitis. Delay in diagnosis may lead to complications like cataract as it was in our patient, which is a real concern in young children. The snake is no more, but it has left its footprints even without having feet.